What happens when somebody's not a good candidate for medication? What then?
Well, a lot of it depends why they're not a good candidate for medications. Are they not a good candidate because there's nothing biological going on, that medications really don't have a potential benefit to play? So if that's the case, well, then we got to figure out what is it that we need to do. And I'll give you an example where this comes up. Somebody comes in, I would say, grade school, who's really, really struggling in school. They're not focusing, they're not paying attention, they're underperforming. And the reason they're not a good candidate is not because they're not a good candidate because there's nothing to treat. They don't have ADHD, it's not an anxiety issue, it's not a mood issue, it's a learning disability.
Sure.
It's so basic, right? They have a learning disability, and so they come across to teachers at school and parents at home. They're really having a hard time sitting down and reading. They're really having a hard time sitting down and getting their homework done. But fundamentally, it's a learning issue.
Sure.
So in this case, and again, common sense says, hey, sounds like we need to address their learning disability, right? We need to either remediation from tutoring to, figuring out and deciphering what is the right school setting, the right school structure for them. So that's just one example. It's kind of common sense, right? They don't have anything to treat with medicine. So that's just one, example. Another one which comes up is when I will get older teens and college students who come in who are asking for medications for anxiety or depression, but they're drinking on a regular basis alcohol, or they're smoking marijuana on a daily basis and with no intent to stop. And this is more frequent than people realize, where they're in distress, they're not feeling good, and they will say, well, the reason I'm drinking and the reason I'm smoking weed is because I don't feel good. And so I want a medicine, help me. And this happened recently to me. And so then the conversation says, well, are you feeling bad enough to want to stop what you're doing? Well, no.
Yep.
I say, well, you're not really a good candidate. It's not safe. It's not safe for you to go on medicine. We'll say, no, but I need the medicine to help me to feel better. I go, yes, but you're putting something in your body that's potentially negatively
Going to counteract or
It's going to make medicine do not work or exacerbate.
Yeah.
So again, that's just another scenario. So I think the somebody not being a good candidate, a lot of it depends on the reason, and there's all sorts of reasons. One of the other ones is medical, right? And especially as people, for some adults who, let's say you have high blood pressure, or you have a cardiac arrhythmia, and you want to go on an ADHD medicine. Well, that's a problem. There's a contraindication to that. I have several kids I see who do have certain cardiac arrhythmias, who cannot go on the stimulant class of medications, which is interesting because that limits then their options, and their children have real ADHD, and it is problematic. And I think the reality of saying, wait, my son or daughter has ADHD, and the most commonly used medication I could help them is not even an option. And I've had some of these patients see cardiologists who say to me, you can't do this.
Right.
And I go, okay, so how do we work within that? And that's where we start thinking, classroom fit. Are they in the right school? Is the school equipped, or can they manage this? Understanding medications are not an option. This is where we talk a lot about behavior and environment, and actually helping the parents understand what it is that makes their children behave this way, and where is it that they need to extend grace to their kids, and realize, it's just not the end of the world that they can't sit at the table for dinner. Would it be nice if they did? Yes, I could say that as a parent, it would be nice. But if they have to walk around and they kind of sit for a few minutes, and we know that this is just who they are, do we really want to punish them for that? Probably not. So a lot of it, goes back to the reason they're not a good candidate. Sometimes people are not good candidates because they're not able to take the medicine every day. And I've kind of run into this sometimes with some of my high school, college kids, where they basically say, I can't remember taking medication every day.
Yeah.
And I go, well, I don't want to prescribe for you because you're going to be miserable. Your moods are going to be worse doing the medicine. So it's worse to be on a medicine on and off than to not be on medicine.
Right.
So a lot of it really depends on the reasons why. I genuinely believe that for the majority of people who are struggling with certain things like an anxiety or depression, as long as they're not in a severe range, they can be equipped to manage their symptoms without medicine. And I kind of recognize this, the longer I do this, that people could really be helped, genuinely be helped, without medicine more than they realize. If they start looking at their symptoms differently and kind of having an understanding of why they're thinking this way, why am I feeling this way, and really going to the deeper root issues, they can truly find peace and joy in their life without medicine. And and just to be clear, I think there's certain psychiatric illnesses that are like schizophrenia and some like manic depression, bipolarity, and things like that that are really, truly, genuinely disabling psychiatric illnesses that I think would be tougher to manage without medicine.
Right. Certainly. Certainly. Now, that's so important, because I'm thinking about, a patient, say one of my patients that's really thriving in therapy, has been coming for a couple of years and really is doing well. And the question becomes, or the question that I'm asked is, can I come off my meds? Should I come off my meds? Or they're feeling really confident. They're saying, I'm feeling really good, and there's this little side effect, or there's, just a few things that are going on that I know are medication related that I would like to see if I can cut out of my life. So for a patient like that, what would you say? Would you say, let's try, do the trial, or?
That's a great question, and it's a very common conversation that I have with a lot of people. A lot of it depends on their history. So if they've been on medications for a couple of years, and let's say they were treated for an episode of depression, and that's why we made the decision to go on medication, they're doing well, then yes. If this was their first episode of depression, and then my goal is to help them to get off, and I do it slowly. Just like I go on very slowly,
right.
I get off very slowly, so I could know at what spot they start noticing, going, I'm not as good. And a lot of times that doesn't automatically mean I go back up. I go, okay, you're not as good. Can you learn to manage this not as good? Can you figure out a way therapeutically to be able to handle whatever the depression or the anxiety symptoms you're having before we go down any further? I'm a big believer in getting people off medications, especially children and teenagers, because I find that a lot of kids, when we do treat them and they learn to do life without the lens of anxiety, without the lens of depression, I see this clinically, there's a certain resetting, especially when combined with good, effective therapy. They've started looking at their situations very differently. That even if I start getting them off their medications, they're still okay.
Right.
The other piece to it, besides their own history, sometimes is family history. I see a lot of kids and teenagers or adults who have very strong family histories of certain things. And when it's a tough call, it's a decision, do we talk about getting off medications or not? I really make that decision on an individual basis. I don't have kind of saying everybody should get off medications. Everybody needs to stay on medications. My preference is that I want to give people the opportunity to begin to lower, and for us to see what happens. That's my general preference, and that's what I generally do. I do have some people who are adults who have said to me, I've had anxiety for 45 years. Boy, is it nice to do life without anxiety. Why would I get off the medication? If I'm tolerating it fine, I don't have any medical side effects, I'm sleeping fine, I'm eating fine, I feel regular me, but just without anxiety. I think I'm just going to see you till I'm 90, whichever one of us leaves this earth sooner. And I've had people have that conversation with me, where they basically have no plan of getting off. They don't want to. Even then, I will try to convince at the right time that maybe they've done enough of life now without anxiety, that they've learned how to do life without anxiety, that's worth it, or without depression. But I have some people who get frustrated with me when I talk to them about wanting to lower their dose. They're like, stop asking me that. I'm just going to continue seeing you. So it's certainly an individual decision, and I make that decision for each patient, separately. I don't have a rule.
A global.
No, not at all. Not at all. Which makes sense, right?
Yeah,
everybody's their own person and different, has a different story.
Sure.
So.
Sure. Cool. Great. All right. Well, I think that's what we have for you today, and hopefully you found all of this information useful. And let us know what you think. Thanks.